where are we headed right now?
So right now we're headed to a row house in Glover Park, Washington, D.C. And we'll be meeting up with a young woman who I've seen before. The purpose of the visit is to actually do some laboratory work. She's been seeing a specialist, a gastroenterologist, and with symptoms of bloating and discomfort and cramping, but really not able to find any diagnosis or anything that really explains why she's having it. So she thinks it could very well be kind of food allergy. She had the standard testing, and any of these labs, the standard testing really doesn't reveal much. It reveals things that are glaringly obvious. You know, it's so far in your face, but it doesn't really uncover the subtleties. So this is a very specific laboratory. It is actually called Genova, and this lab actually will test not only allergies, but or certain biochemical markers, which I'm a biochemist by training, and I want to be able to see is, you know, what's exactly going on, what's causing inflammation. If inflammation's occurring, there has to be like a cascade of things happening, and it's a question of what's starting that cascade, and then what can be done to kind of reduce it or eliminate it completely. So it's very frustrating for her because traditional medicine is not, or modern medicine is not helping. It's reached the limit as to what it can do. And it's reached that limit not because of the clinicians, it's reached that limit mostly because of insurance. Insurance won't pay for this test, which doesn't make any sense, because not only is this test to help treat a condition, but also prevent conditions in the future. So it's very frustrating to clients when they hear how much, you know, something like this is going to cost, and all said and done, this is probably going to be around $2,000. But at the same time, she's been miserable. So it's you know, I don't like patients to be miserable, but you know, there's a certain appreciation of you know, you're investing in your health. It's very hard for people to wrap their head around, you know, doing things preventatively. You know, if I can get a patient 20 years before they develop hypertension and give them subtle tools to reduce it, then the reality is they don't, most likely would not ever need to get on medication. They can live a normal, healthy life and not be dependent on healthcare to keep them healthy. But preventive medicine is, you know, there is no integration into modern healthcare. It's everybody seemed as being kind of quacky, or there's that's just you know, some doctor who's just trying to, you know, gouge his patients and you know, on things that really don't make any medical sense or scientific sense, and that's absolute rubbish. Absolute rubbish. Here we have, you know, medical community, some of the top experts, and they've kind of, well, we don't know why, but you know, hope you do well. So that sucks for me to refer a client and then find out that the specialist really can't find anything. And I'm not necessarily saying I'm going to find something that they couldn't. I'm just willing to dive deeper, in large part because, you know, the client understands that my service is, I'm kind of like a hired gun. I'll do whatever it takes. Clinicians who work in practices have to go through a number of patients every day. They can only do so much. They're only human, but insurance makes them inhuman. And my personal opinion is that I can do so much more, not having been a slave to the insurance companies. I mean, I've taken care of patients, you know, for over 12 years, and invariably those patients that were elderly passed away. And you know, even in Georgetown, just passing by, you know, numerous houses that you know, are kind of like ghost houses for me. I have the memory of being in the house, going through the front door, seeing the living room, seeing, you know, their life unfold. And that chapter is closed. So there's all this sense of literally every neighborhood I go through, if I think about it, there are ghosts everywhere. And I don't, it doesn't creep me out. It just kind of wakens up that memory again. Seeing that and then experiencing it has given me a certain sense of value for what life to me means, and really being able to embrace it. That's why I can't be in a clinic. I got to get out. I got to see these things, because I would never get down to the level of seeing my patient die, in their home. So everybody, this is my good friend Steven. He comes out and helps me draw blood. General great guy, great positive energy. Known him for a little bit, and we're gonna do some great things for patients moving forward. But yeah, this is what it's about. It's about relationships with others. Yeah, definitely. We help patients out, and we have the same kind of chemistry. So it works all around. Yeah.
Same hairstyle too.
Yeah.
Sounds like the urn. Have you drawn her before?
Maybe.
Okay.
Yeah, she's an easy sit.
Hold that for me real quick.
Yeah, sure. Good morning. How you doing? Very good, very good. So my phlebotomist and I are here. His name is Steven. So we'll come on up. It's just 2 tubes of blood. It'll be in the urine that she collected from this morning, and then we'll be out. Shouldn't be more than 5 minutes. So that was quick. Hey.
Good morning.
How's it going? Yeah, everything went smooth for that house call. It was really follow-up, and it's actually much more involved. It wasn't just this visit. I've known for quite some time now, and her family too. So it's been kind of on this journey with her for an illness that is undefined at this point. So it's, she understands that I'm invested in her. I want to see her better. And so this visit was to do the testing, follow up with the testing. It's not straightforward. This case will remain open for probably, it takes 3 weeks to get the results. So we have to wait until then, and then we get it back. I'll look at the data, and then I'll make recommendations based on that. So it's more complex, and it's kind of like when you see a movie, but you don't realize how much effort has to go into making that movie. It's kind of the same thing. That's why, for some individuals, they wonder about the cost. Well, there's a lot of involvement, and so you're not just paying for a visit. You're paying for essentially the experience. When these labs are completed in 3 weeks, I will actually sit down and review the data. And then only when I've reviewed it and can make recommendations based on that, then I'll reach out to him, and we'll set up another meeting, basically. I try to do it so that there are actionable items, so that it's not like, here are your results, good luck. It's more of like, okay, these are your results. These results indicate this condition, and these are the steps you need to do to basically manage that. And it really is management. It's not, you're not curing anything. You're tailoring a process for a person to make them invested in their own management of their own health. So there's a laboratory called Genova, and they're the ones that I've used consistently. There are many others, and they all promote different things. it's tricky because you have to figure out what's the right test, and it's not as simple as just you pick that and that test tests everything that you want. You usually have to combine different tests to get the answers that you're looking for. So we've taken this sample and, basically in 30 minutes you need to get this processed. Some places will just keep it really all day and then won't actually finally freeze it. So the quality of the sample is not what it should be. So, and then you get faulty results. So that means just the level to which, I have to ensure everything is done right means sometimes I just have to do it myself. So this is my centrifuge, my trusty. I've had it for like 10 years, processed hundreds of samples. And from the kit itself, what we took, we got a urine sample, which I will now freeze to keep it in good order. Just has to be the right volume and no more nor less. I'll stick that in the freezer. And here for the centrifuge, just 2 tubes. You just have to balance those. And that's it. Let that run for 15 minutes. As soon as that's done, then I take so this is blood that has to be separated. That's why we use a centrifuge. Once that separation has occurred, then I can actually transfer it into separate tubes. And these are the tubes that I will actually use to FedEx down to the laboratory in Tennessee. So now while I'm waiting, I'm just getting all the rest of it prepped up, completing all the paperwork, and box it out. And you can see from yesterday, this is a sample from another client, and that will go out today as well. And usually, unfortunately, what happens most times in clinical practice, the physician their sole job is to see as many patients as quickly as possible, so they'll hand this off to somebody else. Well, my experience is
once you've done that, then you really don't know what's happening. That's why I like kind of try to do it all myself. It's the only way to be absolutely sure. And still mistakes can happen, but at least I know how it happened and won't have to keep doing the same mistake. Grab my scissors. So this morning, as you can see, going out into the field, coming back, this is kind of home base. Things are in the works, but there are plenty of more things that are happening throughout the day. I have another client that's going to be coming here to do some COVID-19 testing. They're going to pull up with their vehicle and I can test them right here. All the while this sample is being prepared. After this is done, drop it off for shipment. And then I'll check in on other patients, particularly the patient who's at the Mandarin Oriental who put his back out. There's a patient I saw yesterday who had an infected eye who's doing better but still need to follow. And really just kind of breathing through the day as it were. One of the great things, the pandemic is starting to wind down here in DC with the vaccinations that have occurred, and you can feel the energy in the city. Certainly you can see the traffic that is coming back. People are, I would think, coming out of their cocoons, and it's great to see all of that. It means that there'll be plenty of more opportunity to get out there, interact. I think with patients, but also other, health advisors and other people as people transition from this period of being confined in their homes for so long, kind of coming out of their cocoon and being able to, exercise and go out and have a nice meal, all of those things. It's just kind of a reawakening for the city, and it's definitely great to see that. And it's great to be part of what the pandemic was and helping, but I'll be honest, I'm kind of sick and tired of COVID-19. So it's good to be back.
And if you happen to find any of this interesting, or more importantly, if you want to collaborate, check out the link below so that you can send us your comments, any stories you may have, anything. We're happy to entertain it. And this is really about us going on a journey together.